Hi, it's Jon and Michelle Braddock with the July BeneFocus video series. This month, pre-existing conditions limitation.
In today's BeneFocus video, we'll be discussing what the term pre-existing conditions limitation means, where it's typically found, and how it is applied in the benefit determination process. Looking at what's generally considered your core employee benefit plans, that being a medical plan, a dental plan, vision, life, and disability, typically, pre-existing conditions limitations are only found in a dental and disability plans. Generally speaking, your life insurance, your voluntary life, your medical and vision plans aren't subject to these limitations.
The pre-existing condition limitation on a dental plan is usually referred to as a missing or broken tooth clause. Teeth that were missing prior to or extracted before becoming insured under a plan usually are not covered and therefore considered a pre-existing condition. The pre-existing condition limitation in a disability contract can be a little bit more complex.
The standard definition of a pre-existing condition limitation is a condition where you've received medical treatment. Medical treatment being either a consultation or receiving care services, including diagnostic measures, or took prescribed drugs or medicine for that particular condition. So when does a pre-existing condition limitation apply? It generally applies to new entrants coming into a plan. So that would be most likely a new hire, or for those people increasing their disability coverage. As an example, if I had a $500 benefit and I elected to increase my coverage to $1,000, then that new $500 would be subject to a new pre-existing condition limitation.
So what period of time is looked at when determining if a disability will be considered pre-existing? The common term you will see are 3 months, 6 months, 12, or even 24 months. The most common being referred to as a 3/12. What this means is that anything you have received treatment for in the 3 months prior to the effective date of your insurance, that particular condition will not be covered for the first 12 months that you are on the plan.
As an example, a new employee enters the plan on January 1st. This employee has high blood pressure and had been taking medication for that. If that employee has a stroke in June of that same year, benefits would not be paid as that condition would be considered pre-existing. Alternatively, that same employee does not have a stroke but gets in a car accident in June. Any injuries would be covered because that was unrelated to the high blood pressure and not considered a pre-existing condition.
In a different scenario, if that same employee started January 1st, had been taking medication for the high blood pressure, but had a stroke the following January, benefits in this case would be payable because they had been on the plan for over 12 months.
It's also important to note that a change in carriers does not trigger a new pre-existing condition limitation for employees. Coverage under a prior plan does count in these situations.
Virtually all long-term disability contracts include a pre-existing condition limitation, and even some short-term disability contracts include this as well. So it's important to understand how your pre-existing condition limitations work.
For additional information on this or any other topics surrounding disability contracts or coverage, contact me or John or anyone on your ISG Advisors team.